are live. Why you ain't turning my hair look like that? Oh my God. I've been outside all day and I've told y'all consistency. This is the schedule. Let's go ahead and drop it up there. So you guys remember this morning when I was putting a new schedule in there and I kind of had it this way and not this way. So you couldn't really see the whole thing. Okay, let's just make sure we got audio. Apologize for yesterday. We did have to do that audio over. Okay, but we did get it right, and that class 4 is posted. This is class 5, and even though we are still going over 3 and 4, it's kind of a big sector, and I still wanted to continue to talk about it. Okay, so this is the schedule for next week. This is for YouTube. This is a YouTube University students. This is a free training that you guys have. If you guys would like the courses, go to sapphirecoding.com and use that key code I gave you yesterday. Okay. And I also gave it to you this morning on that early chat. Okay. And again, this is an independent class, but we have consistency now. Monday, Friday, and Saturday is your consistent days. The Tuesday is added in there because we added it in there because it was a long subject for the 3 and the 4. Okay, so Monday will be 5 and 6. Okay, Tuesday will be 5 and 6. Okay, don't worry about roll of insurance bill or XYZ. That's your main topic. Okay, Friday, chapter 7 and 8. Okay, Saturday, chapter 9 and 10. So you see how we're breezing through medical insurance billing. We're breezing through medical insurance billing because we want to. After this, we're going to dive right into medical terminology. So I'm going to start now. Just wanted to put the schedule up there so you guys can see it. This is for the YouTube University. Sapphire student, Sapphire, you want to follow this, you can. It is the same thing that you get. You just have more stuff to do. So I'm just going to go ahead and take this one down, and I'm going to show you guys a couple of other things that we did earlier. And this is for some people that may not have been able to get in it. You may have been out. I know it's a holiday tomorrow, and I know everybody's out. The protesting is going on, but no worries. This will be archived, and I'm pretty sure that the audio is okay, guys. So let's go into presentation. And again, you guys know what I do. Every time I come on, I go over the books and make sure you have the books. Okay. So let's just do the books first, and then we're good to go to continue on. So again, this is just a backtrack. These are the books, okay, that you need for this course. Okay. And the books cost a pretty penny. So, just be precarious of that. And you do not have to get the books all at one time. This is the ISBN. If there's somebody who's joining my channel that is new, please subscribe to my channel. This is a real course, and we have different things that we are going to do, but just pay attention to the code class that's on the top of the chat, the thumbnail. So these classes will be Sapphire ED CLS 1, 2, 3, 4, 5, 6. Okay, the other courses is Sapphire ED 4, 5, 6, 7, 8, 92. Those are informational chats. Okay, this chat with the CLS is the true class. Okay, so let me go down. That's the HCPCS book. You can get the HCPCS from AAPC or AMA, whichever one you like. AMA is going to direct you to Amazon, okay? And this is kind of a quickie, but, I want to kind of throw a couple of things in here so to make sure you guys get it. That's the ISBN in case you guys missed it. If there's anybody on this chat who didn't get in this morning or last night, here's your chance, okay? Well, it's not your chance, but you can look at it whenever you want to. So these are the 2 books that we're going to use for medical insurance billing. Okay, just kind of backtracking on this. I'm pretty sure you guys already know, but these are the books. Go to thrift.com or Amazon. You may get it cheaper. Okay, catch Amazon at 4 or 5 in the morning. They may have $20 or $30 off. Okay, and again, you do not have to have the new books. Okay, guys, step by step. Step by step is your go-to. These are the books that they use in the college. Okay. See, it's pretty pricey. It's like $100 and something and 40 something. I prefer the ebooks, which I'm gonna show you guys the ebooks in a second. Okay, language of medicine. You guys know language of medicine comes in the Sapphire course. Okay, And again, doesn't have to be a new one. All I do is change the cover. Most of the stuff in there is new. The exercises are in there as well. Okay, the exercises are in there as well. So again, we're just kind of backtracking. You guys know when I start my class, I always go over what we went over before. Okay, so let's go over the student schedule. You guys have already seen this, but we're just going to do it for those people who missed out. And again, you always can archive, okay? So again, this is what we start with. This is medical terminology. Medical terminology here. When students first start my class, they start on medical terminology if they do not have their book. If they have their medical insurance billing book, they will start here. You see, you guys see, yeah, yeah, this is familiar, right? This is what we are working on. And remember, we have a consistent hour time for class, okay? The time is consistent. If you have a problem, even if you work in a hospital, you work in a physician office, Miss Lisa, this is what happened in the office today. What should I have done? Miss Lisa, I'm having a problem with this code. I don't think it's right. I can't prove it wrong, but we're going to find out, or eCoder or Optum 360. Okay, so, let me be your go to. We are trying to do consistency. Consistency is everything. My channel is normally, I kind of sporadically throw a video out or something like that, just to kind of give you insight on what this is about. Some of my earlier chats you guys can take a look at as well. But again, this is your schedule right here. Well, not really a schedule. It's pretty much your summary of what's going to go on in your classroom. Okay, here, medical forms. Those of you who was with me this morning, this is your medical forms. And again, we're just kind of backtracking. I am going to throw a little bit more coding in here because this is your coding sector. Okay, computerized billing. You guys know what that is. That's the EHR. We use Meditech in my class, and we just I give them insight on EHR. Okay. So again, that's pretty much what it's about. Just kind of making sure that you guys have what you need. And there's also an orientation class that we did put in there. Um, you guys have that orientation. I did. I have a small one in there. I think it's two chats. Yeah, I think it's two chats. And then I have the big one. It's 60 slides. Okay. So remember, those 60 slides are in there. It's on a chat. I'm just going to pull it up real quick just to kind of give you a heads up on that chat. Okay, so you guys remember this. This is in another chat. This is about 60 slides. So this is not what we're going over today, but this is the orientation chat. YouTube. This is for YouTube University. This chat is for you. Sapphire, you guys have your chat. This Sapphire, you can also archive this chat as well. And some of you, I met over 100 something people. Even just from being down here, you don't have to join the class. You can just join the YouTube and look at what we're doing here. But again, if you want one-on-ones and you want to have the precise courses, you guys need to get those courses. And don't forget to use that key code I gave you. It takes off $1,150. Okay. So again, I just wanted to put this up here just as a backtrack as to what we were doing already. Okay, so again, we're still in week 8. Let me get that. Week 8. So this is week 8, and in week 8 is Monday. Even though we did a little bit more Saturday before that Monday, this was your schedule for this week. Because remember, right, we just started this class, right? So Monday 1 and 2, Friday 3 and 4, Saturday 3 and 4. This is what we're doing. Okay, I just threw this up there for a second just to make sure that everybody has this. So this morning we were in Elsevier. We're kind of going to backtrack into the Elsevier, and then we are out of here because you guys already have this. So I'm going to dive straight into 3. Let's get back. I'm going to dive straight into 3 so you guys can get the insight on it. It was a much longer class than I normally do on YouTube, but I'm pretty sure the classes are going to get a lot longer, 2 hours preferably. But because I'm using the free StreamYard, I try to be precarious on it because I don't see what the difference is other than if I need more hours. Yeah, we're gonna do it because what do they give you? 20 hours? What? Listen, if I'm gonna save $120 a month, all I'm doing is 20 hours. Fine, but if I feel like you need more than that, if I feel like I see a lot of communication in the community, yeah, I'm gonna go ahead and get the more hours one. Okay, guys. So right now I am going to let me get that share screen in there on the book that I want. Right now, I'm in my library, and you guys know I try to go over a couple of things with you so you could see also what's going on. Let me move up a little bit. All right, so this is pretty much the library. I'm not there yet. I'm getting ready to put it on for you guys in a minute. Let's get rid of this. And then this is pretty much the library. This is my library, and again, I use the ebooks. Okay, so this is the book you need right here. This is for some of my new people that have not been in on the YouTube already. These are the two books you need for these courses that we are doing now. The medical insurance billing course will be over within a week or so. Okay, probably next week it will be over, but that depends on how you're working. Okay, so if we start moving on to medical terminology, I need to see who's still on medical insurance billing. It's not a problem. I need to make sure so that I can make sure that you guys are getting the correct work. Okay, so again, you need this book and this. You need these two workbooks. One is a reading and one is a workbook. Okay, and that's going to keep you on track. That's going to keep you on track. Okay, so let me remove that. Then I'm going to go back to the book. And let's go ahead and open up the medical insurance billing book. And then this will get us back to where we're supposed to be because we really didn't get to go over the 3 and 4 as much as I wanted to. Chapter 3, those of you who have your books, those of you who don't have your books, this is where we are. We are on chapter 3. That's it right there. Okay. And this is what we pretty much went over earlier because this is what we are on. Because it's kind of long and you might want to go and purchase your book. Okay. So there I am. I'm going to go in there and I'm clicking on this portion right here. We've already went over this. I'm just kind of backtracking on this because what I want to do is show you the exercise book. Okay. So that's why I'm just kind of backtracking just to kind of show you. So that's what we went. That's what we went over, guys. So this is chapter 4. Okay. I'm going to share again. We also went over this in chapter 4. So today, what we're going to do is we're going to look at the workbook. We're going to look at the workbook since we have not looked at the workbook yet. We went over this morning. And the workbook, I'm going to show you how it's going to correlate with what you've done already. Okay, and the work that you're going to do. And being that you guys are on YouTube, you guys that are on YouTube, this is how you are going to do your work. I don't think it'll be a problem. If as long as you stay on track, and if you have any question, you guys make sure you send me a message through YouTube or that email. You remember I made that email, Sapphire Physician Coding at gmail.com. Okay, I made that specifically for you guys in YouTube. Okay, so the Fortney workbook is workbook Fortney Medical Insurance and Billing by Linda Smith. Okay, by Linda Smith. That's the book that you're going to be getting. Okay, so I'm gonna share my screen right here real quick. So you guys see this? These are your key terms or your abbreviations. These are your key terms of what you're going to do in this book. You see where it says study outline? That's pretty much what it is. Okay. So I'm gonna take that down real quick. We don't want to get copyright. I gotta watch how long I leave this stuff up here. Okay, so this is the workbook. Okay, now I'm going to role of an insurance billing specialist. We've already went over this. As you guys can see, let me show you. This is the same book that you're gonna get. Same book, but this is the workbook. So you guys remember we've been going over the reading. This is the end of the first week. This is where you should be. So from the work that we did earlier, I'm counting Saturday because we actually started last Saturday. This is what you will be doing. Okay. It's the same thing. It's going to correlate with what you did in the reading. Okay. What you did in the reading. Okay. Let me get to, here. Very good, very good. I have to show you this. So this is the work you're going to do. Okay. And again, elsevere.com, get this book from there. They have 25% off, just giving the school code. Okay. But this is the workbook. But you guys see what I was talking about, how when you read the book and then you get the workbook, this is how you're going to do the workbook. Okay. This is how you're going to do the workbook. And to me, originality is everything. And I told you we're going to change the world. We're going to change world education. One day it's going to be 1,000 of y'all on here. I don't know how many of y'all are on here now, but one day it's going to be 1,000 of y'all on here. But this is the workbook that you are going to use. I don't care if it's a review from Cuba, okay, and you in on my YouTube. Make sure you say, Miss Lambert says she's going to change world education, okay? Join her class, okay? This is the workbook. This is the work that you're going to do that is going to correlate with your chapter 1, chapter 2, and chapter 3 and 4. Okay, because that's all we did this week. Okay, let me see if I can put this in here. All right, list some of the responsibilities and duties an insurance billing specialist might perform generally, as well as when acting as a collection manager. Refer to the section on job responsibilities. And it's actually giving you the sections, which that's something new. They didn't do that before in the old book. Okay. Number 7, documentation of the clinical notes, history, physical exam, diagnosis test, results, diagnosis plan, and treatment related to the patient encounter. I'm going to share it with you real quick. So you see, you having the workbook and the reading book were both combined. So you guys who are in the YouTube University, this is how you would get your know-how in. This is how you would get your know-how in. I will not give you tests and competencies. You don't see that. You only get that with the downloads. But this is what you will see. But you guys let me know. If you feel like you want to do more, let me know. We'll make something specifically for the YouTube, but I can kind of change it around a little bit. I have to make sure there's no copyright on my test. Okay, so again, this is still chapter 1, but remember, chapter 1 had three units, 3 units in it, right? Let me go back. Role of an insurance biller is what we're starting with, but there were 3 units in there, and that's what we're going to do. Okay, this is good. Oh, let's do this. See, how okay? There you go. So I can't put it up for a lot, but I'm putting it up now. See, this looks like testy stuff to me. You see that NPP? Make sure that you study that. Okay, I can't read it from here. That's why I gotta do it from here. So if you guys don't see me, I don't know if you can see me or not, but I'm gonna go from here. Part 2, multiple choice. 2 billing components are facility billing and professional billing. Professional billing is done for. Answer the question. I ain't giving it away. Answer the question. Does somebody know what it is? Yeah, it's this one. Okay. Let me go. I got to take that off. Too long. But I'm going to still be looking at the book. But in your book, like I said, this is part 2, multiple choice. Okay. Multiple choice. Physician extenders are healthcare personnel trained to provide medical care under the direct or indirect supervision of a physician, are also known as C, right? Non-physician practitioners. Okay. So I can't read the whole thing because of copyright, but this is another section. Part 3, true and false. Okay. Insurance billing specialists have a well-defined scope of practice. Is this true or false? I'm going to show y'all what it is. Is it true or false? So you guys see in the workbook is amazing because in the workbook, this is where you're going to get your retain from. This is how you're going to retain. So we've already did those chapters and units. This is where you're going to do the rest of your work at. Okay. Let me just go through. They've got critical thinking in here. I don't know if this was in the other book, but critical thinking is in here. Critical thinking. To enhance your critical thinking skills, problems will be interspersed throughout this book. Thinking is the goal of instruction. We definitely need that when it comes to coding. And a student's responsibility. When trying to solve a problem by critical thinking, it is desirable to have more than one solution and take time to think out answers. So they're absolutely right. I mean, some people are very skilled at multiple choice. One of my besties, I mean, she has a skill for knowing which answer to choose on a multiple choice test without even studying it. She knows. So your critical thinking as to which answer you're going to choose on your CPC is so critical. It's going to cost you your exam. So just make sure that I have grease in my hair. That's why it's horrible. Y'all know how I am about my hair. It's driving me nuts right now. I didn't even comb it or anything. Anyway, just be precarious of the answers that you choose. Yeah, because y'all know I'm dying to get up and get a comb, but I ain't gonna do it. We're gonna do this class. Okay. So let me get back to the book. Okay. So did I show y'all? Let me show y'all this piece right here. Let me show y'all this. It's a screenshot, so they can't get us. It's a screenshot. So you see, this is the workbook. That's the workbook. That's what I'm YouTube. This is your work. Okay. Now a lot of people have issues. If they get something free, they don't put 100 in it. If they pay $27,000, they put 100 in it. But you have to think the opposite. Go to a billing and coding course. Tell me what's in it. Tell them what I give you. I'm not giving you all of that unnecessary stuff that you don't need. You don't need psychology. That has nothing to do with what we're doing right now. You need to learn how to do billing and coding. That's what we're going to do. And then we're going to walk our way into the coding. So again, remember y'all, this is a beginner class. This is a beginner class. I can't even say it. Okay. So just make sure that you follow my same instructions, directions. Write one or two paragraphs describing where we at. Okay, this is critical thinking. Let me put it here so you can see it too. I'm gonna put it there for a few minutes. There you go, and then I'm gonna go ahead and read it. It's just saying, write, use a computer and use your browser. Okay, I can't see it from here, so I gotta come out. Okay, so these are the directions. I was up here. Wait, you can't see that. Hold on, y'all. Hold on. Let me get back. There you go. Okay, directions. Write one or two paragraphs describing why you are training to become an insurance billing specialist. Oh, I love that. Yeah, guys, go ahead and do that and send it to me. Send it to me in a message. You don't even have to send it to me. Just do it. Write it down and tell yourself, why do you want to be a medical billing specialist? That's an amazing question. It really is. It really is. If you got your books already, answer it. You got to do it anyway, so it's in your book. Okay. And the other one is visiting websites. Directions. Directions as in this is what they want you to do. Use a computer. I hope this is moving as I'm moving. Use a computer and use a browser to access the internet. Go somewhere and search. And you guys already know how to do that. Everybody is familiar with searching. Okay. Because we do it all the time, right? Okay, so again, here we go. They have different type of scenarios, and it's just practicing and telling you what it wants you to do. Okay, so you see how easy that chapter is. It's very quick. It's very quick. Let's get this in there. This is two that you did last week. I'm just kind of running over it. This is an exercise that you should be doing. Okay, and that exercise, like I said, when we do a chapter, you do the exercise. You have your workbook right here, have your reading book right here. As you read, you can go ahead and do your exercises. Okay, so those of you who do not have your book, remember you can go to Kindle. Kindle will show you the first few 50 pages or so, and at least you can kind of work on that until you get your book. Okay. And again, don't forget, those of you who do not know anything about medical insurance billing, make sure you look at that medical billing Q&A. That book is on Amazon. It's $30. Miss Lambert written that book. So I wrote that book for people who don't know anything about medical insurance billing and would like to know without joining the class. Or maybe they want to subscribe. You guys know anybody who want to subscribe to my channel, learn medical insurance billing and code them, let them subscribe to my channel, and they can flip through many videos that I have. Okay. Or they can join us in this classroom right now, but they will have to catch up because I'm not going to go back. They're going to have to catch up. Okay. So again, this is Which one is this? Privacy and security. And this is pretty much telling what we're going to do. HIPAA, don't forget that HIPAA there. It is not double P. Okay? It's not a double P on a HIPAA. Just make sure you remember that. Okay? So again, this is a workbook. You see where it says workbook? So you guys remember this morning we were working on the reading book, right? So now we're primarily working on the workbook, and we're just pretty much going through what you're going to do. Okay. Oh man, this is good. I got to show you this because a lot of these what you see right here, you're going to see this in your CPC book. You see all of these, and then we go over some of this before. See, they want you to put the definitions down here. That's it. And it's your book, so you can write in it. You can write in the book, okay? You can write in the book. Of course, you can write in the book. You buy the book, you can write in the book, okay? These we need. Make sure you put these on index cards. Put them on index cards after you do them, and you're putting them on index cards so you can have something to actually study by, okay? Did I take it off? Okay, I did. I took it off. Okay. Okay, so this is chapters 1 and 2. It's not even that long, the multiple choice. The HIPAA omnibus rule enhanced what? A, B, C, or D. Patients' privacy rights and protection. Patients' rights to restrict immunization records to schools. Healthcare providers' rights limiting access to patients' records. Business associates' rights to use and disclose patient records. Okay, under high tech, if a breach occurs, the covered entity, okay, does not have to notify the affected party, only has to notify the affected party if they feel it is reasonable. Must notify the affected party no later than 30 days. Must notify the affected party no later than 60 days. So I really believe that this book will really help you in medical insurance billing. It will teach you what OCR is, Office of Civil Rights, HCFAP, Healthcare Fraud and Abuse Program. This book is amazing. Everything in this book, let me show you right here. Let me show you something right here. Everything that is in this book is what you will be doing in your job as a medical insurance billing specialist. Okay, so I know everybody's probably out there in the protests and stuff because you guys. I usually see you guys popping in and out, but that's okay. You guys can go ahead and archive this. I'm so glad that we did the chat this morning because a lot of you got in on that chat, and thank you so much. I really appreciate you. Thank you to all of my subscribers. I really appreciate you. Without you, this cannot be possible. We cannot do this. It would not be possible. So thank you so much. Okay. So we're going to keep it moving. Okay. And again, your critical thinking for this chapter is also here. Make a decision using your best judgment after reading each case study regarding whether it should be considered an incidental disclosure, a HIPAA violation, or neither. Okay. And again, each one of your chapters will have the same thing. Okay. While waiting in the reception room, a patient, Xavier Gomez, overhears a receptionist talking with another patient on the telephone about a colonoscopy appointment. There was a closed window between the waiting area and the receptionist. Explain. So it looks like they are giving you scenarios. Yeah. Okay, so this is a scenario portion. I'm gonna show you real quick, and this is something that's in the book. So when you guys get your books, this is the scenario portion, and that's why they're giving you those scenarios. Okay. So let's go back. And again, each one of your exercise chapters are pretty much just saying, I'm going to give you all this because www.amaasn.org or www.hhs.gov HIPAA. Let me screenshot this because maybe you guys want to go on this and take a look at it. So just if you got your phone, just make this bigger so you can see these websites. Okay. They put them there so that they can help you. And again, this is the exercises that we are going over. This is for the YouTube University, Medical Billing and Coding. Okay, now let's go to chapter 3. Okay, so chapter 3 is compliance and fraud and abuse. And this is what we went over this morning. This is the exercise chapter for that. Okay. They all have key terms, so they have something for you to study by. Abuse, anti-kickback law, auditing, Civil Force Claims Act, clustering compliance, compliance plan, Criminal Force Claims Act, exclusion statute, false claims, federal deposit insurance. I can't read all of them. Make sure you guys go over CLIA. CLIA. That's in chapter 3. Make sure you go over clear, okay? Because that's something that's going to be on your test. They're just going to ask you what it is and what the definition is. It's part of your eponyms. Remember, I was telling you about those eponyms? Okay, DHHS, DOJ, Department of Justice. You guys know some of these things you've been hearing on TV. MAC, Medicare. Don't get this one twisted. This one has one with anesthesia, MAC, and then one is for Medicare. Okay, so make sure you don't get those two twisted. MAC, okay, OIG, OSHA. Just make sure you study those. Okay, performance objective, same thing that's in the other one. This is what they want you to do. Define and spell the key terms, key abbreviations for this chapter. And you don't have to do all in one time. It looks like a lot. Um, and that's why you do not have to do it all at one time. Just kind of take your time. I would set 2 hours a day and get this done, 2 hours a day and get that done. Okay. So don't kill yourself when you don't finish. It's okay. And that's one of the reasons why I put Medicare all the way, Medicare Monday all the way, and then you guys come back again on Friday, because during that couple of days you should be working. Now next week I did add that other in there, and I added it in there because I had already put the Tuesday in there. Okay, but again, you guys already saw the schedule, so I don't need to put that one up again. Okay. Your study line, study outline. You're going to study compliance defined. You're going to study compliance audit and oversight. You're going to study compliance program. You're going to study OIG. Okay? Part 2, multiple choice. And again, like your exercise is going to be based on what you have read. You're going to have your key terms in there. You're going to have a BB. I'm going to let you see this. I guess I can let you see real quick. Okay, so you're going to have your key terms in there, your abbreviations in there. Can you guys see me moving this? Performance and objectives. Every single chapter has the same format. So this right here is part 2, multiple choice. So when you read chapter 3, remember there's probably about 3 or 4 units in there. When you read chapter 3, this is the chapter that you're going to do. So you guys remember this morning we did the book. We did the reading book. Now we're going over the workbook. Fortney's medical insurance billing. So right now I'm just going over the multiple choice for those of you who might have just came in. One of the agencies charged with enforcing laws that regulate the healthcare industry is the. Okay, so just make sure that you are studying this. You see where I'm pointing at? I ain't gonna say it because then I want to give it. I want y'all to read it and study it. This is for the YouTube University. You must do the exercises explicit because you do not have the tests from me. But my tests are derived from what's in here. So make sure that you get this done. Okay, the initiative that allows CMS to contract with entities to combat fraud, abuse, or waste is. Make sure you guys read this. Okay, Medicare Integrity Program. Let me make sure you can see this. Yeah, so I'm thinking you can see it as I move it. So the initiative that allows CMS to contract with entities to combat fraud, abuse, or waste is Medicare Integrity Program, Civil Monetary Penalty, Healthcare Fraud Prevention and Enforcement Action Team, HEAT, Recovery Audit Contracting. You guys can tell what it is because I'm not going to give it away, but you guys just read it in your reading book. So just remember, your reading book is going to correlate with this. Those of you who are in the Sapphire class, you have tasks from me and you have competencies from me as well. But you still have to do the exercise from the medical insurance billing book. You don't have to do the exercises from the step-by-step, okay? So let's just go over these two real quick because they look pretty good. I kind of like these right here. I'm number 16, healthcare providers who determine that they have submitted false claims should resolve the issue by seeking the Department of Health and Human Services. GHHS, put that on the index card, y'all. And OIG, guidance established in 2006 and referred to as. This is crucial. I don't know if y'all can see my face or not, but that's crucial. That may be on your CPC. Those of you who are going to move forward to your CPC, when you hear me say retain that, you retain that for your CPC. Okay? Because a lot of what you're doing in this medical insurance billing class, you are going to see some of this on your CPC. The CPC is not just coding. Remember, I told y'all about those open and close questions. When you get to those opening questions, I would prefer you to do the open and close questions first because they're going to be 2 minutes for each question. So that's why I give you practice tests. You guys got a practice test so you can bump up on your speed. If I give you him test right now and you sit there and take 10 minutes on one question, we got a problem. Okay, so that means you need more practice. You got to speed it up. You need more practice. Okay. There's a certain way that you have to. There's a certain way that you have to read notes. That you have to read documentation, and you're gonna have to get it up here. The more you practice, the more you do. The more you practice, the more you do. The faster you will go, because you cannot drag around after 2 minutes. If you take more than 2 minutes on a question, it's gonna take away from when you get that big case. It's going to take away from time for you when you need to use more time. So when you get to open and close questions, just try to answer the question and keep it moving. Okay. But like I said, some of this is on your CPC. I can see it right now. And this is what I mean when I say open and close. You see how it says compliance is the responsibility of physicians, coders, anyone working in healthcare, the compliance officer. This is an open and close question. You answer it, you're done, you closed. On the cases, no, those are not open and closed questions. You're going to have to figure it out. You're going to have to make sure that the diagnosis code and that CPT code match. Okay, so remember what I said when I said the answer is in the question. Every test you take, the answer is in the question. Pay attention to how I'm getting ready to tell you this. The answer is in the question. The question was derived from the answer. Right? So that's how we decipher what the answer is. So on the CPC test, when they give you a case, the case answer is right there. And the first thing they give you, you're going to see the diagnosis at top anyway. And then they're going to give you the body of what happened, of what type of surgery it was. Single out the ones that it's not. If you have a case and you're going to get them, you might have 3 or 4 that's this long. And they're giving you multiple choice. Single out the answer that has nothing to do with the case, has nothing to do with the surgery. Okay, I know that's not it. So boom, that's not going to be it. Especially if it's going to be a series that's going to give you a problem. Okay, so some of you might not know what series is. Series is a 20,000 series in the CPT book, a 60,000 series, 70,000 radiology. That's how we talk about it. Pathology, 80,000. You guys will get to know that as we move on and we get down to your core courses. So right now it's pretty much your prereq courses. So just remember your prereq courses are medical terminology. Is a prereq course. Medical billing is your prereq, ICD-10, and CPT. Those 4 courses are your prereq courses because I am teaching you as beginner how to do medical billing and coding. What is a CPT? Why do we need 7 digits? Why do we need an X? What is sequela? What is late effect? This is what we are doing now. In order for you to hit the coding, we've got to decipher this first. Okay? Part 3, true and false. Every single one of them is going to have true and false, guys. Every compliance program should include a method for employees to report issues anonymously, true or false. To submit an insurance claim for medical services that were not medically necessary is a violation of the FCA, true or false. So, due to copyright, I can't go over all of them, but I tried to leave it up here long enough so you guys can actually see it. When you get your books, you're just going to follow the same way. Those of you who did were not able to get on the chat this morning, please get on the chat this morning because yesterday we had a pickle with the audio. So we did get to do it. We did it over like 3 times, but this morning it went through and the audio sounds good. So make sure you correlate this morning's chat with this one because what we went over this morning will correlate with this and it's going to combine. We've already done one Monday and this is just continuation of 3 and 4, but I will backtrack over that so you guys can see that. Okay, so again, this is critical thinking for fraud versus abuse. Two totally different things. CPC. What's the difference between fraud and abuse? A, B, C, and D. Multiple choice, open and close. Answer it, done. Boom, answer it and done. And your book is going to decipher the difference between fraud versus abuse. That's why it's crucial. This is for YouTube University, for you guys to do your exercises. My regular Sapphire students, they do this and they have tasks that I give them, quiz and competencies that they get. Okay, and when you guys get down here, this is just pretty much giving you websites to look at. This is the most important one that you're going to look at right here, your AAPC. What I would do, some of you who are getting ready to take it, even if you're not in the classroom or you're already working, or I'm in the other YouTubers class, but I want to just look around and see XYZ. Go on aapc.com. When you go on there, go into education. It's going to show you what's on the test. If you, God forbid, but if you fail that test the first time, you won't get the same test, but you will get the same thing that's on that website, probably in a different order. So this is why it's better for you to go to school for all points. And right now we got the YouTube University class going. This is a real class. I'm teaching y'all from my accreditation CrossWalk. Okay, so that's what I want you guys to follow. And remember, if you have any questions, just let me know. Let me know what you need, especially if you guys are working already and you stuck in the office. And oh my God, Miss Lambert, what I forgot how to do XYZ. I will tell you. I'm gonna share my screen with you because I'm gonna show you where we at. So I will tell you. So just send me a message and I'll try to help you out. Okay, so this is Basis of Health Insurance. Remember, this is the one that we did this morning. Okay, this is just the workbook of what we did this morning. In the Sapphire class, they do have to give me a summary on each chapter that they did. And they have to give me a summary because I need to chronologically know that they understand what they just read. At the end of the medical insurance billing, everybody gets a competency. The competency is a big test. It's about 50 questions. And you have to pass with a 70. YouTubers, you too. I'm going to give you all that same test. You have to get a 70. If you get a 70 on this test, then you move on to medical terminology. If we've got to go over a few more things, we will. But you can move on until you get that. Those of you who are following me on the classroom, there's some of you just kind of working independently. That's fine. And you can always backtrack this. But this is a real class. We got to keep it at a real class. Okay, y'all? So key terms. Key terms are what we studied in this chapter. Accounts Receivable Management, Affordable Care Act. When you do the Affordable Care Act, make sure that you put the year on your index card. So you want to put ACA and you want to put the year that it was created, okay? Put the year that the act was created. What is a birthday rule? This birthday rule is regarding Medicare, okay? It's in this book. Blanket contract, capitation, claim, coinsurance, contract. I'm just skipping down because we can't do more because of copyright, deductible. But when you guys go home and you are doing this, that's fine. Don't forget, you can go to thrift.com. You might get this book for $20. Not the new one. You might get it for $5. I know somebody who got the older one for $5. You can probably get 12 for $8. It's the same stuff that's in there. The only thing that Linda does is change the cover. That's what she does, is change the cover. That's all I do with my book, is change the cover and update the codes. But remember, I have new books. If you guys get stuck, I will give you whatever new codes that's in there. Okay, because you still have a small skit of PCS. So I don't want you guys to buy a PCS book. I'm going to teach you from my PCS book. That's Procedural Coding System. That's Hospital Procedure Coding. Okay, almost the same as a CPT. Okay, but not quite. It's hospital. Okay, revenue cycle. self-pay, third-party payers, TRICARE, unemployment compensation, and yes, Veterans Health Administration. You guys might work in a VA, so that's why Linda made sure she put every single thing in here. And don't forget, if you have somebody who is not familiar with medical billing, what is coding? What if mom says to you, she wants to know what it is? Point her to my medical billing and coding Q&A book. That's the reason why I made that book. I made that book for everybody to understand medical insurance billing and coding. The book is on Amazon for $29.99. I've given YouTube University the book. So I put that book on here in ebook form. Look for, because I think we finally had got it. I was like, wow, we finally got the book on here. Look for that green chat. My book is there, and you guys can have that book for free, especially when you know somebody who, wow, I want to get on it, but I don't know nothing about billing and coding. I don't, what is that? That's why I made that book. Okay, our chat, even though we have a schedule, I always throw a chat out there before time. More than likely, I'm going to come on and do another chat tomorrow. That's outside of your schedule because I'm trying to give you a little bit more. Tomorrow we can go over the Q&A book. I created that book. They can't give me a copyright on that book. The book belongs to me. So especially if you guys know people who are not sure about medical insurance billing and coding, that's the reason why we made that book. You know what you see on that book? Lisa Lambert, Sapphire Physician Coding. Okay, I've given YouTube that book. Okay, so again, this is chapters 3 and chapter 4, and this is the workbook for it. And the good thing about this is it's the same thing you get in a college. The same books that you get in a college. It is the same. You're getting a free program from YouTube University. Y'all thought I forgot. I remember 4 years ago, I said that one day I'm going to be able to give you this course for free. So guess what? We're rolling. We're rolling. Everything that I do in my regular class, you see how I start off this class? I start off the same way I do if I was in the classroom. When I'm in the classroom, my students are there. I'm right here. I might be in front of a podium with the book, but it's just as if you're out there and you have a book. Let's say I'm right here, and there you all are over there. You have your book. You can't touch me? You don't need to touch me. I'm right here, right? So this, I'm just putting it up again because this is next week's schedule. I threw another day in there because it was kind of long, so I want to make sure you guys got through with this. So you guys see how we are moving through medical insurance billing. And you're going to get the gist of this as long as you follow it the way we are doing it. So Monday, you have Monday's class 6 o'clock, and you guys see the 6 o'clock as a consistency. We are consistent with the 6 o'clock. Tuesday, medical billing. Okay, you see rollover insurance, privacy and private act. Same stuff that we are practicing right now. That's what we're going to do then. And I left the privacy and act because as a whole, that's what this book is about. Okay, so just be precarious of that. That medical insurance billing book you're going to need. Okay, I think I jumped out of it too quick. I'm gonna go to it to make sure you guys have it because I put the ESBNs on it. This is the books right here. Now these are the new books. You don't need to get the new book if you can't, if it's not possible. If you go on evolveelsevier.com and put in your school, this is for the YouTube students, my students too. You guys have your books already, but the YouTube students, if you guys go on elsevier.com, I've already put the link in there on, look in class 1, the elsevier.com link is in there. Tell them, put it in. It's going to say, what school do you go to? Put Sapphire Physician Coding, LLC, or Sapphire Physician Coding. They're supposed to give you 25% off. Okay, if they got a problem with that, call me and let me know because your school is in there. YouTube University, your school is YouTube University. Your subject is Sapphire Physician Coding. Your concept is medical billing and coding. Okay, I'm sorry. Y'all know how fast I be talking. That's your step-by-step book. For some people who've gotten in late, this is your step-by-step book. Again, you guys know this is a self-paced class, but I want you guys to stay on some type of a schedule for yourself. Okay, the schedule that I just gave you, that is for YouTube only. I have a schedule. If anybody wants the real schedule that we go by in Sapphire, I will send it to you. So don't worry about that. That schedule have a 6 week, a 20 week, and a 40 week. Most people who are doing the 40 weeks, they are combining and they are finished in 10 weeks. Some of those girls are ready to take their test in 8 weeks. So that depends on you. If you can pass everything I give you, I'm going to say, go for it, girl. You ready? You pass that him test that I give you, go for it, girl. You ready? Or guy, I'm sorry. If I hire somebody, I don't bug on her because she doesn't have her CPC. If she passes this test, I'm hiring her. But the bottom line, I had a coder one time. They just hired her just because she passed her test, and she didn't know nothing about coding, nothing. And guess whose team? She was on my supervisor's team. And I said, listen, show her everything you know. Show everything you know. She all she knew was she told me. She said, Miss Lambert, I don't know nothing about coding. She said, I read my books, I studied every night, and I passed the test. I said, well, you had a goal to just take the CPC? She said, yes. I said, so you didn't like sit in a classroom? And she said, no. She said she just got the books and she just studied. That's what I want you to do. Study, study, study. These are the books that you're going to use without getting a student loan. Okay? That's your language of medicine book. If you go to sapphirecoding.com and you click on the bookstore, that's my website. You click on my bookstore, you can get any one of those programs. And this book is free. This book is free in my class. It's $112, but this book is free. I give you this with the Sapphire class. And I also give you the medical billing and coding Q&A book. That's sapphirecoding.com. Click on the bookstore and you can see them. It is 51 minutes in, so it's time for me to give you, if you stayed this long, thank you so much. If you know anybody who wants to learn medical insurance billing and coding, please tell them to subscribe to my channel. This is free. This is a real course. This is a real schedule that I use. Why, Miss Lambert? Because I was the director of the school and I had several instructors and I created the medical billing and coding program. I added coding in the medical assistant program because it should be in there anyway. So trust me, if you guys want to know anything about Miss Lambert, read my bio, okay? When you go to Amazon.com, just put my name in, my book should pop up, or put in Sapphire Physician Coding. So this is the key code. If you guys decide to go on my website, sapphirecoding.com, the key code is hashtag key212. That takes off $1,150, and you only pay $199. You're paying $199 for all 21 points. So I have 21 courses in there. Another orientation, your syllabus is in there, your crosswalk is in there. You have guides in there. You get unlimited one-on-ones with me. You get tests, you get competencies. I grade all your tests and I want all your summaries. It's a real school. My virtual school is a real school. You get a Sapphire Physician Coding email as well, so you can have access to the portal. Okay, so I'm going to jump right in here. I'm going to jump in here again just because I want you to see what I'm looking at. So right now we are on basic health insurance and we're pretty much done with this. I just want to make sure that you see what you have to do. This is for my YouTube students. So I want you guys to follow your class the same way we do. Follow your class the same way Sapphire does. So see, look, we're on the workbook. So you have your reading book and your workbook. I'm going to backtrack and go to the reading book because we're actually done with this. This is what we did. I hope you guys are still on this page. So we went through 1 and 2. You did that in the beginning of the week, and 3 and 4. And this is the workbook that you're going to do that in. So now I'm just going to kind of backtrack to my library. So this is my library, guys. Okay. So you guys know I like to try to show you the library so you can see the books that are there. You see that says elsevier.com. These are all instructor books, but you can get regular books. And sometimes some of, like language of medicine, and there's another one. There's even numbers. There's odd and even numbers. If you do odd or even, and you might have even, I have the teacher's book. I will grade it for you. This is for my YouTube students. I want you guys to feel like it's a real school. We're going to change world education. I cannot do it without you. 4 years ago, I kept a poster on my car 4 years ago, and I asked people to join my YouTube. And I look in there, look at my chats, and you will see it. It's crazy. I said I need 1,000 subscribers. I said if I get 1,000 subscribers, I promise you I'll give you a free medical billing program. Mind you, I've been doing medical billing since 1999. I started in the OR as an OR tech in 1999. I went to billing and coding because I was too emotional with the craniotomies and looking at the brain opening up in the chest, and it was driving me nuts. So my doctors, my surgeons, they booted me out. They asked me, did I want to do billing? And in 1999, I said, well, what's that? And look, I'm still doing revenue cycle. So trust me, we want to get you on the right track without you paying $22,000 for a course. We want to get you on the right track. When I go over Monday, I'm going to show you a true bursaw with how much a medical billing and coding course is with the classes that they have. Yeah, I'm saying, I ain't gonna lie. Many years ago, I went for medical insurance billing and code. I had no idea. I didn't know what it was. I only went because the hospital was paying for it. They paid for me to go to school, and I'm like, well, what is that? What is it? I had no idea. But guess what? They failed to teach me. They failed to teach me and tell me that I needed to have a CPC in order to do the coding. Why didn't y'all tell me this? Y'all teaching me this a little bit, and I'm teaching me that, teaching me. What's the purpose? And I just felt so bad. I didn't start feeling bad until I started directing the school. And to see my students paying $22,000 for something that I can teach them hardly for nothing was crazy. But I'm so proud of them. Bennett, Charlotte, all of y'all, I know y'all are working. But I wish y'all didn't have to pay $22,000 for medical insurance billing and coding. But y'all are the reason why I made this program. And I'm so glad that I added coding in to the school program. All of my students are doing good. I won't say 100% of them because I don't speak to all of them, but most of them keep in contact with me through YouTube or my Facebook. But again, those of you who are going to join this class, make sure you take heed to Sapphire ED CLS. That's for this class. The Sapphire ED 2345, Sapphire ED 55, that's for informational purposes. So if you know anybody who do want to get in on the class and they come in, let's say they come in next week, they do need to backtrack on those videos so that they can keep up with us, okay? So again, for this class, we are doing the medical insurance billing. This is the Fortney's medical insurance billing by Linda Smith. She is a master at what she does. This is the workbook also by Linda Smith. This is her workbook. We must do this. For my YouTubers, you guys don't have the courses that we do at Sapphire, but you will get the same information so long as you do the exercises in this book, okay? This is the 2025. This is the Bucks version. Bucks version can also be bought on Elsevier. This is step by step. That's ICD-10 for physicians. But I prefer when you get ready to take your test, I want you to get your AAPC book. This is for strictly for teachers, but I want you to get your AAPC book, and you can get that from Amazon or aapc.com. Okay. If you get this from here, yes, you still get the 25% off. You guys see the 2025 step-by-step medical coding, the workbook, and here is, I don't know if this is the reading book or the workbook, but this is both of them. This is the workbook and that's the reading book. That is your go-to. That is how you learn how to do coding. Check anywhere. Check. Find y'all a medical billing school. I want y'all to come back and tell me what they got in there. And if they teaching you a bunch of unnecessary stuff added to the billing and coding stuff, okay, why? You know, I would be dying to see their crosswalk because every single school, every college that you go through, they have to go by a crosswalk, and accreditation has to have approved that. So they don't just teach you just whatever. They go by a crosswalk. I go by a crosswalk. The thing is, I add stuff in my crosswalk, especially when I was in the college. I always add stuff in there, okay? Because you always need to know more. When accreditation came, I had everything, Paul. So it was nothing that they could ask me about. That is the reason why Sapphire Physician Coding is built on accreditation and what they expect us to have. Theory, practice. Theory is reading. Practice is tests. your exercise. That's what that is. So accreditation comes in. Miss Lambert, how long does it take to do the medical insurance billing class? Well, I got a 6-week, a 20-week, and a 40-week. Miss Lambert, how many hours is that? 300, 200, and 110. You see how quick I did that? You're gonna have to be par when you're messing with accreditation. I did a video also on accreditation if you guys want to know about accreditation. And the reason why I try to make sure I'm par with that, because at some point I'm going to try to find not a big facility, a small facility, kind of like Panera or something like that. And I'm going to have computers in there, and we're going to have like a physical school. But I've been had the online school for many years, so I want you guys to check that out. Do not forget that key code. It's 59. I can't believe we already an hour in. The key code, if you stayed this long, this is your key code. I still have that grant going on, $1,150. The key code is hashtag key 212. Okay, so this class went so fast. And this is why I need to do 2 or 3 classes a day. But because I have the StreamYard, I have to cut it down to an hour. But you guys know that I'm going to give you more. I'm going to give you more. I got to open this book because you know I hate this book. But I got to open this book. It's so much stuff in there that's so invasive. I gotta check it off for a minute. But remember when I be talking about illustrations, right? I just want to go over illustrations real quick because I want you guys to make sure that you understand. You see how it says a copyright on it? That's why I can't keep it up too long because they'll give us a penalty on it or something. So I'm gonna find like a small illustration in here, even though let's find Indoctrate. I know they got some pictures in here on Indoctrate. I just want one because I just want you to see what they be talking about when they say illustrations. Oh, this is a good. Oh, I don't know if I can show this. All right, we can show the top part. We can show the top part. We ain't gonna show more. That's illustrations, okay? That is illustration. We're 1 hour in, and it's time for me to go. And I just wanted to show you guys that part. And that's all we need to show y'all. This chat is over. I will see you next time. See ya.